Dystonia. What is dystonia? Dystonia is the medical term for a neurological condition with various manifestations. It belongs to a group of diseases classified as movement disorders. Dystonia is caused by a dysfunction in the brain's movement control centers that regulate muscle activity. This can result in repetitive involuntary movements such as tremors, muscle contractions, and/or abnormal body postures. The involuntary movements may be caused by muscle contractions in a specific muscle, a group of muscles, a part of the body, or even the entire body. Dystonia can affect muscles in localized areas, such as those around the eyes, neck, or limbs, focal dystonia, or larger regions like the neck and arms, segmental dystonia, one side of the body, hemidystonia, or the entire body, generalized dystonia. Dystonia can occur at any age, but is relatively rare in children and young people. The condition is considered chronic. For most forms of dystonia, the exact cause is unknown. Studies suggest that dystonia occurs more frequently within certain families, indicating a potential hereditary component. Most cases are classified as primary dystonias with no other detectable neurological conditions. Normal movement requires coordinated muscle contractions in a predetermined sequence, but in dystonia, a dysfunction in the basal ganglia, a brain area responsible for muscle coordination, results in errors in signal transmission from the brain to the muscles. Secondary dystonia can arise from other neurological conditions, such as multiple sclerosis, Parkinson's disease, brain injuries, or as side effects of medications for nausea, psychosis, anxiety, or depression. Symptoms vary depending on the affected body parts and may include twisting or involuntary movements, grimacing, abnormal postures, tremors, and muscle cramps, often accompanied by pain. Symptoms are typically less severe in the morning and worsen as the day progresses, with stress, fatigue, and strong emotions acting as aggravating factors. However, dystonia manifests differently in every patient, and some might have worse symptoms in the morning. It might feel like the brain have forgot how to walk or run correctly, for example. Symptoms may subside during rest or disappear completely during sleep. Diagnosis is primarily based on a neurologist's clinical examination. Imaging techniques like MRI, along with blood tests and other investigations, may be necessary to exclude other conditions. There is no cure for dystonia, so treatment focuses on symptom relief. Common treatments include medications, physical therapy, and in some cases, botulinum toxin injections to reduce muscle overactivity. Advanced cases may benefit from surgical interventions like deep brain stimulation, DBS. Types of dystonia. Focal dystonia affects specific muscles such as those in the neck, cervical dystonia, eyes, blepharospasm, or hands, writer's cramp. Segmental dystonia involves two or more adjacent regions. Generalized dystonia affects most of the body and usually starts in childhood. Task-specific dystonia, triggered by specific activities, such as writing or playing an instrument. Cervical dystonia causes abnormal head positions and tremors. Blepharospasm involves involuntary eye muscle contractions, potentially leading to functional blindness. Spasmodic dysphonia affects voice muscles, causing speech difficulties. In children, dystonia is often secondary to conditions like cerebral palsy or genetic disorders. Early diagnosis and targeted treatments can improve outcomes in some cases. Dystonia is chronic but not life-threatening. However, it can significantly impact quality of life. Psychological support and patient education are critical to help individuals cope with the condition. In cases of focal dystonia, where only one part of the body is affected, injection with botulinum toxin is the preferred treatment. Botulinum toxin is a substance that inhibits the transmission of nerve impulses from the brain to the muscles. This effectively weakens the muscles, thereby preventing the painful contractions. The effect becomes noticeable after 1 to 2 weeks, and the treatment can be repeated approximately every 3 months. Accurate identification of the affected muscles, carefully chosen injection sites, and tailored doses for each specific patient are critical for a good treatment outcome. Treatment with botulinum toxin has proven to work well for most patients, with up to 90% achieving satisfactory results. Some may experience side effects initially, but these typically subside after a short time. Currently, there are 3 commercially available botulinum toxin A products, Botox, Dysport, and Xeomin, and 1 botulinum toxin B product, Neuroblock. DBS, deep brain stimulation. For patients who do not respond sufficiently to botulinum toxin, DBS may be an alternative. Using advanced brain surgery and technology, electrodes are placed deep within the brain and connected to a battery located under the skin on the chest or abdomen. Stimulation helps normalize the patient's movement patterns. The treatment is effective, has few side effects, and most patients experience a significant improvement in motor function and quality of life. DBS surgery for dystonia is an established treatment for patients with severe cases and is performed at 6 university hospitals in Sweden. There are few research studies supporting other effective medical treatments with acceptable side effects. Current medical treatments may include pain relief, spasm-reducing medication, and drugs for anxiety and depression. Some patients benefit from levodopa, which is used in Parkinson's disease treatment. The need for medical support is evaluated in consultation with the patient's general practitioner and neurologist. It is important to be cautious about medications that may be habit-forming. The intensity of involuntary movements can often be reduced if the patient touches their face or supports their head, known as sensory tricks. Some patients experience improvement by imagining performing these tricks, but this does not work if someone else performs the sensory trick for them. In dystonia, the body uses healthy muscles to control involuntary movements and compensate for reduced function in the affected muscles. This can lead to painful, fatigued muscles and diminished functional capacity. Physical therapy focuses on unlearning incorrect compensations, preventing tension in unaffected muscles, strengthening stabilizing mechanisms, relaxation, stabilization training, and increasing awareness of compensatory movements. Direct manipulation of dystonia-affected muscles is not recommended. Physical therapy must be individualized, as patients have varying tolerance for activity. Training should be done in collaboration with a physiotherapist and avoided during periods of severe pain or spasms. Low-intensity training can be introduced when improvement is noted. Exercises in water have been shown to reduce pain, improve mobility, and enhance balance in patients with cervical dystonia. Living with dystonia. Many patients struggle with the challenges of living with a chronic condition, such as fatigue, reduced energy, anxiety, depression, and diminished quality of life. Chronic pain, spasms, and abnormal postures can restrict movement and limit activities. Additionally, abnormal muscle activity in one area can affect healthy parts of the body, leaving the patient feeling drained and despondent. Abnormal movements and postures may lead some individuals to avoid public settings due to fear of judgment, resulting in isolation. The challenges associated with dystonia are highly individual, influenced by numerous factors. Identifying and maximizing periods of improvement can be beneficial. Like other chronic illness patients, individuals with dystonia are encouraged to stay active with moderate exercise, eat healthily, get enough sleep, and prioritize mental health. Stress over time exacerbates dystonia symptoms, making it essential to avoid heavy labor and repetitive activities. Family and support. Dystonia affects not only the individual, but also their loved ones, including partners, parents, children, friends, and colleagues. The type and extent of the condition determine the impact on family dynamics. For some, the condition leads to significant lifestyle changes, emotional strain, role shifts, and additional responsibilities. Open communication between patients and loved ones is crucial for maintaining healthy relationships. In some cases, professional support is necessary. Relatives may need to recognize their limits and seek practical or financial help when needed. Maintaining personal well-being and striving for normalcy are vital for caregivers to remain a resource. For children in the household, the illness can pose unique challenges. Children may feel guilt or take on excessive responsibilities, which could affect their development. Support is necessary to help children maintain a balanced approach to their lives. Research on all forms of dystonia has grown significantly worldwide over the past decade. It falls into 2 main categories: basic and clinical research. Basic research investigates the biological processes causing dystonia, including genetic mutations and abnormal cellular signaling in the brain. To date, 27 mutations linked to dystonia have been identified, specifically DYTY28. The goal of this research is to uncover the underlying mechanisms of dystonia to develop effective treatments. clinical research focuses on optimizing existing treatments and discovering new ones. Both types of research are essential to improving management and ultimately finding a cure. Advances in technology have accelerated the identification of dystonia-related genes, paving the way for new therapies. This concludes our deep dive into dystonia. We hope that you found this information interesting. Links to sources are in the video description. We wish to sincerely thank you for watching and to wish you an amazing day.